Okay.
Good evening. I'm sure you all have heard about transplants, the various organ transplants. The transplant that made the biggest news was back in 1984 when the first heart transplant was successfully done. These transplants goes down into the tissues. Today I hope to convince you to become an organ donor or seriously think about becoming an organ or tissue donor. According to according to organdonor.gov, the organs that can be donated are the heart, the lung, the kidney, the small intestine, the liver, and the pancreas. Also, infectedtissue.com says that when you donate an organ, for the organs, your heart has to be beating and your lungs have to be working in full, whether you are hanging on or if you are brain dead. Even if you're brain dead and you're being kept alive by respirators, you can still be an organ donor. Infectedtissue.com also states that if you donate tissues, your heart and lungs do not have to be functioning in order to donate that tissue. I'm going to be talking about the cornea transplant. The cornea is defined as a transparent, dome-shaped anteater that covers the outer part of the eye, and that covers the pupil and the iris. Transparent meaning you cannot see the cornea. The cornea is what my wife, Denise, is going to talk about because she's had 2 cornea transplants. My wife, Denise James, she's 50 years old, and she's had visual problems ever since she was born. She first had her cornea transplant in 1999, and then a second one, and that was in 2005. Denise, got some questions for you about your cornea transplant.
Alrighty.
I should say.
Excuse me, boy.
There's a doggy in front of you.
There's a doggy in front of me.
There you go.
My leader dog.
Okay, explain to the audience what your, in a brief way, in a layman's terms if you could, what exactly is your vision before and right now? I mean, I don't think the cornea helped improve your vision, but it improved it enough to where you can use it better. Explain to the audience what your vision is.
I was born with a rare eye disease called proliferative vitreoretinopathy, which involves the retina. I was born with cataracts, and I lost my right eye at age 33 to the disease. Degeneration of the cornea that covers the front of the eye, the anterior means front, clear that you can see through it, began to cloud up and reject. When I went to the eye doctor, I thought I was having allergy problems. My vision was getting cloudy. My eye was very red and irritated. And when he told me I needed a cornea transplant, I'm like, no shit. He sent me to my regular eye specialist who also specializes in cornea transplantation with a high success rate.
So in a manner of speaking, the tint kind of deteriorated from the inside out.
Actually, I'm not really sure. I know that the cornea is made up of layers, that the layperson would never realize this, that a cornea, if injured on the front when you scratch it, like people that wear contact lenses, that corneal tissue can heal itself within 7 days. If you lose the underlying layer, the endothelial cells, you have to have a transplant. And the cornea, when it degenerates, it fails to lay flat on your eye, and it makes you feel like you have a hair or something in your eye at all times, and it makes your eye very irritated. It clouds up to the point that I really couldn't see anything other than a little bit of white light, and became very sensitive to light. My left eye, since I have retina problems, this is the only eye I have, its visual acuity is lacking, but the cornea actually makes it clear enough that I can spot the E on the eye chart on a good day.
So the cornea pretty much deteriorated, and it was painful, and it itched, and it was just very uncomfortable, wasn't it?
It was. It was, and that's the reason why I needed a second corneal transplant, because my disease decompensates the cornea anyway.
Okay, the first time you had the cornea transplant back in 1999, explain what you were feeling when you had to wait, when you noticed, or when the doctor told you you needed one up until when you had it. What were you feeling as far as emotion?
I was nervous. I don't relish the thought of becoming as totally blind as you are.
Thank you, thank you.
What little bit of vision I have, I'd like to keep, and I was nervous about, would I be able to keep it? Would I be able to see afterwards? Would I still be able to work? And then when I rejected the first one, I had to wait a year for the second donor, because the doctor is very particular about the health of corneal tissue, and the summertime, unfortunately, and not to be morbid, is the best time of year for accidents and unnaturally caused deaths for folks that might donate their loved ones' tissues.
And the first one you got from a 38-year-old, and the second one you got from a 19-year-old. So age really doesn't matter as far as the donor, correct?
Correct, as long as the tissue is healthy. And as he said, with lungs, kidneys, the main organ transplants, the organs have to be alive at the time of transplantation. With tissue donations, blood, cornea, they can be preserved for a little while without the need of the body to support them while they're waiting for transplantation.
Explain to the audience the procedure of the cornea transplant, because you were awake, and most people do volunteer to go to sleep, but you were sort of in twilight, weren't you?
I've been through so many things with my eyes that it's no big deal to me. They clean your eye up, they take a little ring and they hold your eyelid open with it. Then there's a little bitty ring that they attach to your eye, because if there's no support for your eye and they remove your cornea, the eyeball will collapse and you'll lose your shape. And all they do is they take the new corneal tissue and graft it onto your eye with sutures. They sew them inside and on the outside. And after they've sewn the new cornea in place, they'll make sure that there's no leakage from the inside of your eye out or from the outside in. And I could see immediately after surgery, because the cornea is clear, the clear graft means you're going to be able to see through it regardless of the potential that your retina has to perceive.
Now, as far as recuperating goes, the sutures are taken out shortly thereafter, but you have to stay on steroid drops for a year to 17 months. Is that right?
In some patients, actually, the sutures, if they don't cause a problem, can stay in the eye for the rest of your life. Some patients, about 50%, need steroid drops to prevent rejection. Those of us, like myself, that have glaucoma, steroids can increase the pressure, so they use cyclosporin eye drops. That cyclosporin is an anti-rejection drug that won't cause a steroid effect.
Okay. And you've had this one for 5 years, and there's no problems? You get it checked out normally?
My doctors are good. He examines my cornea every 3 months.
Excellent. Excellent. So it looks like this one is going to be in the 90th percentile of success rates according to the Indiana University School of Medicine. Excellent.
I'll keep it as long as I can. Thank you.
Yeah, thank you. The first cornea donation was done in 1905, and since then, a lot of improvements have been made in science and medicine. Now you may be asking, what do I have to do to become a tissue donor? First, you have to go to your state's registry. And Florida has one. It's at donatelifeflorida.org. What you do is go on there, sign up, tell it what you want to donate. Secondly, you will need to go to the DMV to get your license or ID, and check that box and tell the place where you're getting your ID that you do want to become a donor. Keep that card on you at all times, because if something happens to you and if your family does not know, then whoever takes care of you in case of an unfortunate accident will know. But you do need to tell your family, so Everybody is in the know on this. I hope I have convinced you to become an organ donor, or even seriously thought about becoming an organ donor or tissue donor. If you don't want to give up your heart, or if it's disease or whatever, if you feel like you have something else on your body that works and that will extend the life of someone else who might need it, please do consider it. It's very important to those that do need it, like Denise here. Thank you.